Okay. Which of the following organisms is most likely responsible for the patient's lung abscess? A 58-year-old man with a history of alcohol abuse presents to the emergency department with a 2-week history of fever, cough, and foul-smelling sputum. On examination, the patient appears cachectic and his breath has a foul odor. Chest X-ray reveals a cavitary lesion in the right lower lobe with an air fluid level. Can I ask you, what I really don't know what to make of when they say the words air fluid level?
Yeah.
What does that mean?
So air fluid level just means that if I were to draw this, right, I'm going to draw it up. I'm going to draw the alveoli. Let's draw in kind of the classic formation that is kind of stemming, from the side. So if this is an alveoli, right, you have some kind of fluid, right, that because of gravity, fluid is what is more dense than air, right?
Mhm.
And so you have some kind of fluid that sits at the bottom, and then you have air, right? And so when they mean air fluid level, they're talking about how, either an abscess or have you like, in this instance, like an abscess, right? An abscess pocket, and air fluid level just supports that even more, that there's liquid that sits at the bottom with air kind of on top, which is what they call an air fluid level, right?
Yeah.
And so that points you more into a direction of there's either an abscess pocket in the lung or an empyema, which is just another pus pocket in the lung. So something like that is what you're thinking of, especially every time you mention air fluid level, that's what they're trying to say. In
Cool.
different,
Okay.
just in different contexts, it could mean something different though. But most of the time when you say air fluid levels, you're really thinking about like pus.
Pus or abscess or pus or okay. Okay. So with that, every time I see alcohol abuse, I really just think of anaerobic bacteria.
Okay.
And that could just be to my fault. I don't think they support anything here with Klebsiella. I always think Klebsiella is like with with a person who's been in the hospital for a long time. And
Okay.
so I'm gonna get rid of that. TB would have different symptoms in my opinion, and he also hasn't traveled anywhere. So no. And alcohol abuse is most likely firstly like leading, like that's a risk factor for like inhalation.
Yeah.
And
Yeah,
so,
exactly.
yeah.
So the way I want you to work through this, so this is going to be your answer choice, of course, right? And correct, of course, but I want you to look just slightly different here. The way I
Okay.
would think is I want you to commit to a diagnosis. Okay. So I want you to think in reverse, since this is called aspiration pneumonia, right? Or you can call it inhalation, right? But it's aspiration pneumonia is like the correct term, right?
Yes.
And so I want you to think of the diagnosis first before going to that next step. Does it make sense?
Okay. Okay.
Yeah,
Yes.
because sometimes when you look at answer choices, you have this unconscious bias, right? You read through it and you're convincing yourself of a diagnosis before committing and then looking for an answer, right? So it's going to get you a lot more points if you tell yourself, okay, of course, if you don't know, then of course you don't know. But like a lot of times you do know, right? So you should be like, okay, alcohol abuse has an abscess in the lung, right? Foul odor, most likely aspiration pneumonia. Okay, if I know it's aspiration pneumonia, then which one of these organisms can cause aspiration pneumonia? Does it make sense? Kind of
Yeah, that makes sense.
work
And I
all.
think that's actually a problem that I do have.
Yeah.
So that's a good point. I'll have to remember that.
Yep, always work forward, right? If you commit to a diagnosis, so think of it like this: if you commit to a diagnosis and your commitment was wrong to a diagnosis, and you picked an answer choice that it ends up being wrong, but you supported your diagnosis, then you're pairing it together. You get what I'm saying? So when you're
Mhm.
right, you're really right. You get what I'm saying? So then you can learn. It's like, oh, you missed a question because you got the wrong diagnosis, right? And so then that's an easy fix. But if you're always working backwards, then it's hard to pinpoint, oh, why did I miss this? Oh, it's because I was looking through this and I'm picking, oh, it's anaerobic bacteria because that's usually with alcohol. And then you didn't connect that with aspiration pneumonia. You know what I mean? You're
Oh,
missing a
yeah.
chain in the link, you know? So
Okay.
so
Okay.
always think forward. That's the best. If you work backwards, then it's going to get you in a lot of trouble.